Hi, my name's Dr. Aye, and I'm a board-certified ophthalmologist. Welcome to this channel.
Are you someone whose staple food is grain, oats, corn, noodles, bread or potatoes? Or someone who loves chips or is sweet-toothed? You might be Asian and eating rice 3 times a day, snacking on pancit canton sandwiched between bread slices, chasing it down with 3-in-1 coffee? If you answered yes to any of the previous question, then answer this next question. Do you ever notice your eyeglasses suddenly becoming blurry, then out of the blue, fixes itself, after a few hours or days? When you answer yes again, then either you're a diagnosed diabetic or suspect diabetic. Being Asian, eating carbs daily and having fluctuating vision could be a sign of blood sugar spikes. Don't get me wrong though, diabetes is found all over the world. The highest number of diabetics found in these 3 Asian countries, China, India, and Pakistan. All these Asian countries' staple food are rice and wheat. They may be called many names and come in different forms, as rice cakes, noodles, roti, biryani, or chapati. Well, you might be saying, I couldn't care less. I don't have ants in my pee, so I don't think I'm diabetic. I'd say think again, my dear. Let me look into your eyes, because they might hold the earliest clues. Your eyes could be the very first place diabetes shows up, even before you realize you have it.
Yes, as an eye doctor with over 15 years of experience, I can honestly tell you that I've had cases of diabetics who don't have a clue they're diabetics. So when we examine your eyes at the slit lamp, it allows us to detect sugar control issues even before a regular doctor does.
So, stick around, especially if you've just answered yes to those above questions. Better warned and cautious than sorry later on. This video might not only be a sight saver but a lifesaver as well. Do you know why diabetes is often called the silent killer?
It's called the silent killer because it can damage your body for years without obvious symptoms. You can be clueless about it for a long period of time.
Right. See, here's a common but dangerous misconception. If there are no symptoms, there's no problem. Malie, this is so wrong and could cost you your sight. Aside from being called silent killer, many people don't know that diabetes is also called silent thief. It literally robs you of your sight from under your nose. Now, how does this happen? You see, diabetes leads to eye disease, but it develops very, very slowly. The changes can creep in within about a 5 to 10 year period. You don't notice the change because it is subtle. They're tiny little changes and they won't give out warnings or signs or symptoms until they're pretty advanced. It is like treachery to your own body. Diabetes attacks you from within, but it remains quiet and doesn't give out visible obvious warnings until later in the disease. Thus, it is very wrong for someone to conclude, no, I don't have diabetes, because my wounds heal fine whenever I get one. Malie. To understand this, let's take a quick trip inside your eye. This is a sliced section of your eye showing the inside. It can be likened to a small coconut filled mostly with fluid. Imagine the coconut with its husk, shell, and white meat. The white meat can be likened to the retina shown as red-orange color in this diagram. Only the retina is very delicate and thinner than paper thin. The retina functions like the film in a camera. It captures images and sends them to our brain. This diagram shows how the retina is filled with many tiny, delicate blood vessels. When blood sugar is consistently high, these vessels start to tear apart. Diabetes likes to attack the smallest of all blood vessels. You can see why a lot of diabetics go to dialysis, because it attacks and destroys the many small vessels in your kidneys, very much like how it destroys the tiny vessels inside your eyes. The medical term is diabetic nephropathy if it's in the kidneys, and diabetic retinopathy if it is in the eyes. The root words give the clue. Nephro meaning kidneys and retino for the retina. Meanwhile, the suffix pathy derives from the Greek for disease. Both of them start silently and subtly. Early on, you don't notice anything at all. Your vision might be perfectly clear. But behind the scenes, changes are happening. Over time, these damaged vessels weaken. Then they become either blocked or leaky, causing swelling and blurred vision. In advanced stages, your eye might even try to grow new blood vessels in hopes of making up for the poor service of damaged vessels. However, the new vessels are of poor quality. They are fragile, prone to bursting and bleeding. These result to scarring, which lead to even more trouble like pulling and tearing the retina apart. We call this retinal detachment. Imagine the analogy of the coconut meat being pulled away from its shell. That is what the gray arrows show here.
Okay, look here. This is how tears and detachment look like under our microscopes. Here you are seeing through the front view of the eye. You're looking through clear cornea, which is that glass-like dome-shaped part of the front of the eye. You're looking through a big, dilated pupil, and you're seeing here how the retina is torn and detached, and there is some bleeding on the side too.
As terrible as it may look and sound, diabetes can cause permanent blindness.
Whoops, break muna! Cornea joke time! Mama bear with me and her child Bershka came to see Dr. Aye at the eye clinic. Doc, my kid lost her eyeglasses. Can she have the same frame like mine so we could be tweening around?
Okay, just let Bershka fill up the form.
Thank you, Doc. Love these eyeglasses very much. Now we are twinning.
Okay, let's go back to our sweet topic. It's worth sharing this next trivia because of its huge implication to anyone whose diet is mostly carbohydrate-rich and sugar-laden. Many people live with undiagnosed diabetes for years, sometimes a decade or more without realizing they have it. People discover they have diabetes not because of thirst or frequent urination, but because an eye doctor spotted early retinopathy during a routine exam. We said earlier that diabetes creeps into the eye and gives telltale signs at about the 5 to 7 year mark, so you can imagine how much time was lost before diagnosis.
This is why when a patient tells me, "Oh, I have been diagnosed with diabetes just last year, Doc," I don't take it as face value. I know in my head that most Filipinos have had the diabetes for at least 5 years prior to this diagnosis. Pwede pong matagal na yan, di nyo lang po alam, Nay.
Translate: you might have had it years before, you just didn't know it. Here's another clue to diabetes diagnosis. One of the tricky things about diabetes is how it changes your vision day to day. Literally fluctuating vision even with new glasses.
Sometimes I get this complaint. My glasses are weird, Doc. A few days ago it was blurry, but now it's okay again. My prescription may feel off for a few days or weeks, and then suddenly it's back to normal. What should I do, Doc? Okay, when that happens, when you hear that history, it may be a sign of diabetes. Have the patient tested for sugar.
This happens because fluctuating blood sugar levels can temporarily change the shape of your eye's lens. Believe it or not, your current level of sugar impacts your current vision. It's like your glasses stop working, but then fix themselves once your sugar stabilizes. The blurriness goes away when your sugar levels go back to normal. This is a lesson many aren't even aware of. Watch out for this red flag. Don't go changing your eyeglass prescription if your sugar is poorly controlled. Make sure to stabilize your blood sugar level first before making that trip to the optometrist so that your prescription is more accurate and you don't end up throwing money. Diabetes statistics has grown exponentially because of its character of stealth and subtlety. Today it is one of the leading causes of blindness in working-age adults globally. Anyone with diabetes is vulnerable, regardless of age. But here's a word of encouragement. Much of that vision loss can be prevented if we catch it early. Here's what research and years of eye care experience tell us works. 1. Keep blood sugar, blood pressure, and cholesterol under control. Think of it as a triple defense for your vision. 2. Get regular dilated eye exams, at least once a year. Even if your vision feels perfect, an eye doctor can spot trouble long before you can. 3. Don't skip treatment. If your doctor recommends laser therapy, injections, or surgery, these can save your sight. 4. Lifestyle counts, healthy eating, regular exercise, and quitting smoking make a huge difference. In short, blindness from diabetes is far less inevitable than it used to be, but only if we act early. If you or someone you love has diabetes, remember this: the damage can be silent, but the solutions are real. Protecting your vision starts now. Educating yourself and putting it into practice may save you not only money, but also sight, limb, and even life. Check out this next video as it is one of the more common associated issues of diabetics. Click this link, dear.